The 2020 Walk to End Alzheimer's will be a little bit different this year. It's going to be virtual, but people are still going to be walking and talking about finding a cure to end Alzheimer's. Well, we're joined today by two very special guests to talk about a very special topic that we like to cover around this time every year, but this year things are a little bit different, as we all know. Joining us today, we have Gino Columbara, who's the Executive Director of the Alzheimer's Association of Southeastern Virginia, and of course our Mayor, Linda Johnson. Thank you both for being with us today.
Thank you, Tim, for having us.
Appreciate it.
We appreciate this.
So we're talking about the Walk to End Alzheimer's, and in years past, we're looking forward to a bright sunny day, get everybody outside, everybody gathered together. This year, we're still hoping for that bright sunny day. People getting out there, doing the walking, again, to support the Walk to End Alzheimer's. But things are a little bit different this year. And Gino, if you could kind of tell us a little bit about how this year's event is going to be configured in a virtual world. And I know you're coming to us in much the same format, but again, the goal is to get people out walking and, of course, supporting the cause. So tell us a little bit about how this year's event is going to come together.
Well, it'll definitely be looking differently, but the goal is still the same. To create a world without Alzheimer's and all other dementias. So although we'll be walking separately, we are still united in that same cause. So what we're doing is, obviously for the safety of our participants, our volunteers, our staff, who can't gather in large groups. So we're asking our participants to actually walk in their community, their neighborhood, their parks, in their backyard, wherever they are walking is where the walk is on October 3rd. And so we'll still be out there, and really we'll be exponentially increasing awareness and turning all of Western Tidewater communities purple on that day. So it should be very exciting. And people can go out there. People who register will get these flags, so they can have them as they're walking along and attract people's attention. We're asking people to walk in small groups safely and following CDC guidelines. For sure. The morning of the walk, we will actually have an online opening and promise starting ceremony in which also the mayor will be participating, and Joe Flanagan will be our MC as he has been for several years now. And then after the opening ceremony, there'll be a countdown to the walk, which we typically do, and then we're just going to ask people to go out of their communities and walk. So the logistics in terms of registering the walk are still the same. Going to alz.org/walk, entering your zip code, the Western Tidewater community zip code, and just selecting that walk and registering as a team or as an individual. The important thing is really getting out there because, during this time, and it is a real time, the support is going to be so much more meaningful. So many people who are dealing with Alzheimer's, caring for their loved one at home. It's a very overwhelming and isolating time because they can't get that support that they typically had prior to the pandemic. And obviously, for those who have loved ones in long-term care communities, it's also difficult in terms of their loved ones can't go and physically visit with them. So it is a very challenging time, and we want to try to provide all that support now. And that's what the continued participation and community support will help do. Not only to really end this disease and all other dementia, but also create that community so that no one needs to journey the path of Alzheimer's alone and still have access to a variety of wonderful services.
Well, I think it's a great idea that you guys are able to pull this together and still make this year's event happen, which I guess in the circumstances that we're all dealing with, some sense of normalcy and feeling like we're part of something that maybe is bigger than us is a good way to bring people together, again, for a great cause. So my compliments to you and the team there for pulling this together. And Mayor, I didn't mention it off the top, but you're honorary chairperson for the event. Talk about what this event means to you, directly to yourself.
It means an awful lot to me. I have to tell you, over the years, my mother passed this summer, but she was 97, and therefore I was into the long-term care facilities. Also have been caregiving at home for many years. And, I just want to say that, as something Gino just said about the isolation, this disease isolates anyway, regardless of the situation. The patient is isolated. And going through the homes now, you will see that there are many patients there who do not understand. So I think possibly this is the cruelest disease that I have ever witnessed in my time, because your body may be working everything may be working, but your caregivers, your loved ones are watching you leave them very slowly. And for them, we are not in their minds, but we know the fear in their eyes, and the whole experience is heartbreaking. And I think we need to understand that there's evidence that there can be cures to this and things are progressing, but it's got to come quicker, because as we age as a population, this is becoming a bigger problem for everyone. And my heart goes out to the caregivers and the families, because again, they simply watch their loved one disappear, and that is just awful. So for me, it's just watching the people, their eyes, the expressions, the loss, and I just think it's a very painful way to have someone lose their life ultimately, which is what will happen. So we need to walk, we need to work hard, we need to get a cure, and that, in today's time, those things can happen. So walk, it's healthy, it's safe, it's the thing to do, and I'm just proud to be the honorary chair here.
Well, we appreciate, again, your participation with the event as well. One thing I know, certainly in COVID times, there's a continuing concern about the healthcare system itself being overwhelmed by the response to COVID. But I know, Gino, in looking at Alzheimer's, and certainly it being a form of dementia, the impact on the healthcare system being overwhelmed as we progressively move through time and more people are diagnosed with this, there's definitely a fear there, again, with the healthcare system being deluged with Alzheimer's patients as well, correct?
Oh, most definitely. I mean, the thing with Alzheimer's patients or individuals, they need normalcy, routine is very important to them. And right now, that's all been out the window, and also they are at a higher risk because of their age, majority being 65 and older. Being able to do those behaviors like washing your hands and making sure that you stay distant from others is nearly impossible for someone with Alzheimer's, because they need that constant care and attention. And also many with disease also have other chronic health issues such as associated to lung or heart and diabetes, respiratory. So those all complicate matters. So it's really an additional challenge for the caregiver who's caring for the loved one at home, trying to balance all of that and still create some sense of normalcy for that individual with the disease.
Now, when we talk about Alzheimer's, I know certainly with this particular event, it's a fundraiser, and certainly trying to raise the funds, and we'll talk about the funds in a minute for how that money's being used, but it's also the cost of human life that we're talking about here, and those costs continue to add up. We see it in society. Certainly it's impacted members of our own family and people that we know. If you just talk about what that impact means, again, not just dollars and cents, which is certainly important, but also certainly, again, most importantly, the cost of human life.
Oh my God, well, it's paramount, and we're talking about, I think, someone with the disease and their family, they have a double loss, because eventually as the disease progresses, that individual may forget who their family are and recognize that they forget how to care for themselves and communicate. So, the person goes through a multiple treating process as a family unit. And, we have to really, again, take that urgency of the cause to really be able to put an end to this once and for all. And that happens through research. I mean, right now, the federal government is funding research of $2.8 billion, where 9 years ago, it was funding research at $445 million. So we've come a long way in a very short period of time. I think I've mentioned in previous interviews this year that the association conducts an Alzheimer's Association International Conference on Research each year. Typically, we get about 6,000 registered participating from about 60 countries. Well, this year, we couldn't conduct it. It was supposed to be in Amsterdam. So we went virtual with it, and it was amazing. We had 33,000 registrants, 3,000 scientific presentations, and from 100 countries. So it was just amazing, and the virtual environment was just almost like being there. You actually went into a conference center, you go to the auditorium. It was amazing how they did that. We're translating that in the walk as well. So really participating, creating community, it's about saving lives. It's about really changing the trajectory of the disease. And it takes all of us as a community to do that in a concerted and focused effort. And our voices are so important on the advocacy front as well. So really, we had our first walk of the season on September 12th, and my wife and I walked in our community. And I tell you, the expression of gratitude that people shared with us along the way was really inspiring. So it did seem different, though, just my wife and I walking. But people noticed that with our flags and our T-shirt and everything like that. So it did create some form of conversation and also acknowledgement of the work that we're doing and the work that still needs to be done.
And Gino, you mentioned about the conference, and I know in years past, Mayor, you've talked about a member of your family, or you have connection as far as with the research that goes into this, correct?
Absolutely. Again, I was listening to Gino's numbers there. I remember walking when it was the 400 some million, and then where we are today in the billions. So we are definitely making great strides in that. I also want to just mention that we're talking of this in the terms of elderly, but this is also an early onset disease.
Yeah.
You do not have to be old to get Alzheimer's. Right. The other thing I've learned is that there are numerous types of Alzheimer's. So again, and it's very difficult to be able to know which one you have. Doesn't really matter which one you have, because it's still a life-altering situation, not just for you, but for your family and for everyone that touches you in your life. So again, it's just a cruel disease, and so as we look toward the numbers and we see those numbers rising as far as research and getting the dollars out there for that cure, and there are some medications that have come on, not cures, but medications. So we're seeing progress, but the more we walk and the more we talk and the more we get together and the more we wear that purple and fly those flags proud, then we're going to get an end to Alzheimer's. And it will happen, I hope it will happen in my lifetime.
Right. Well, Gino, if you could talk a little bit about the money that's raised at the events that we've had. Where does that typically go? Where are people seeing their funds going to? I'm assuming there's a combination of local, national, it all kind of blends together, but there is an impact to the community here in Western Tidewater.
Most definitely. I mean, we have well, first of all our services are free of charge. So now that we're in a virtual world in terms of providing services, every week we offer 2 to 3 educational programs, 2 to 3 support groups. We have specialty programs. We just finished a conference in coordination with our Richmond chapter that was open to the entire state and region. So there's really a lot of opportunities to get engaged. We still have our 24/7 helpline, 1-800-272-3900. Day or night, people can get something on the phone to address their immediate needs. We still have all our education for our clinical trial map. So we actually are able to map people to clinical trials based on their needs and the parameters for which they can travel and if they need compensation or what they're really looking for to participate in a clinical trial. So it is really the gamut in terms of full support and also connectivity to those other community resources that can provide additional support like direct care services. So it is really goes into supporting the community and making sure that no one journeys this disease alone. In fact, on October 6th in Suffolk, we're hosting an African American Leaders Forum to really hear the issues and challenges that people are having in relation to Alzheimer's and other forms of dementia, and really get their input in terms of what they need and how we can work together to fill in those gaps. And that's going to be presented in conjunction with the Higher Ground Outreach Church in Suffolk. And that'll be October 6th from 7 to 8:30 p.m. It'll be a virtual event, but if you go to alz.org/SEDA, you can find all the information about that, about registering. Again, it's an African American Community Forum on October 6th. And then I'm also proud to say that the association recently got selected by the Centers for Disease Control and Prevention as the Gold Public Health Center of Excellence, and GOLD meaning building our largest dementia infrastructure for Alzheimer's on dementia-rich concussion. What that means is the association moved to take national effort to develop and disseminate public health strategies and resources at reduced risk of cognitive decline and dementia. So again, we are really looking at that early identification, early detection, and reducing risk.
I know, and the mayor mentioned this as far as get people not just walking when we talk about the walk in Alzheimer's, but also talking. And I guess I would maybe kind of throw the question out to both of you is, when we talk about Alzheimer's, is this still considered one of those diseases, conditions, situations where people are sometimes afraid, or maybe, I hate to use the word embarrassed to talk about it because it's happening to a loved one or someone they know, and they're watching it and they kind of make excuses for them and don't want to talk about it. And that's where the impact, I think, on the care provider really comes in. Mayor, you're shaking your head, so I think
Well, right. I think sometimes when it first starts, there's a sense of denial.
Yeah.
You know, I think it's very hard to realize that someone that you love is going through this and that it is going to be a life-altering event. So I do think there's that. I also think there's sometimes a means of people saying, well, my mother doesn't have Alzheimer's, she has dementia, or she has this or that. But again, so many forms of this disease. And truly, if you want to say dementia, you want to say Alzheimer's, you know, it is not one and the same, but the results are the same. Right. So again, we just have to understand and just reach out. I think that's the most important thing. You know, right now I think we just need to send as many virtual hugs as we can to the patients, to the caregivers, to everyone that's dealing with this disease, because it's isolating on its own, and now we have COVID to make it more isolating. And I have been to a few of the memory units, and I will tell you, residents don't understand. They don't understand that they can't get a hug. They don't understand they have to stay in their room to eat. These are the things that are very trying for the caregivers, who I must give a shout out. They are trying very, very hard.
Mm-hmm.
Most definitely. And I agree with the mayor. The stigma is unfortunately still there. I think it's, increasing, but it's still there. And I think the awareness level is not where it needs to be.
Right.
I tell you, a lot of the community forums that we do to really get the input from the community in terms of their experience with dealing with Alzheimer's or another form of dementia, is that they didn't know about this. Their physicians are referring them to us. So there's still a lot of work to be done on that landscape as well. And I think that's where our voice is. I think that everyone who participates in the walk and engages in anything else that we do throughout the year, they are our ambassadors out there to really try to expand that understanding and that awareness. And we are here to support them and really hear what they have to say and try to address those needs that they're experiencing, and see how we as a community can work together to address those needs. So I think if you're interested in attending that current community forum that we're partnering with the Higher Ground Outreach Church on October 6th, that'd be a wonderful opportunity to share their viewpoints. And again, they can go to our website, alz.org/SIVA, or call the 1-800-272-3900 number. But I hope people will engage with the walk, because Alzheimer's is relentless, but so are we, and we still need everybody's support and energy out there. And they can do it very simply. It's walking in your own community and letting people know that, hey, I think that we were associated with the Alzheimer's Association. Tell me the story. Tell me your why. Oh, I'm dealing with it. You can imagine the amount of connectivity that you will get as you start talking about this. That somebody definitely either dealing with it or knows someone who is. So you can really help them by increasing that awareness by walking in the walk and going to alz.org/walk.
So again, Gino, the date is October the 3rd. And again, we're doing this virtually this year. So we have a couple minutes left in the program today. If you could just kind of recap again how people can participate, how they can sign up, and how they can make a difference. And I guess one of the other things is we've talked about kind of blanket the purple. And I guess that'd be one thing to suggest, wear that color that particular day when you're out there doing your walking, correct?
Most definitely. And the walk is everywhere. So although the online and public registration will be virtual, the walk is actually walking. So wherever you are, the walk is. And really, wear your purple. If you raise $100 or more, you get this great T-shirt. So lead the way to close the virus. That's what we're working for. So they can go to alz.org/walk. Put in the zip code of the community and sign up for the walk. And then on the day of October 3rd at 9 o'clock, we will have an open and promise garden ceremony. And also after the walk, you can go to the hospital on Godwood Boulevard and see a static display of a promise garden. If you only drive by, but that promise garden is very meaningful because it represents the promises we make as caregivers and advocates as someone who's lost someone to the disease. And our hope to hopefully have that white flower of the first survivor and have many of those white flowers. So it's just a different way of doing the walk, but the goal is still the same: to put an end to Alzheimer's and all other dementia, and to ensure that we can continue to extend and enhance our free local services to help those who are enduring the path of Alzheimer's, so they don't feel alone, especially now. And every little bit helps, and every little bit is so meaningful. It's a real time.
Okay, well, Gino, and we want to conclude today's program. As Honorary Chair, Mayor, I want to let you kind of reach out to people to let them know why they need to participate and why this event is so important.
Well, we've talked about Alzheimer's and how cruel a disease this is, and I think what we need to understand is where there's challenge, there's opportunity. Yes, this is a virtual walk, but it can be huge because it is a virtual walk, and it can actually bring in a lot of money and a lot of opportunities here to connect with people. So it is more important than ever that we do this. You don't have to walk 10 miles. You don't have to walk 5 miles. But walk. And above all, wear your purple. You know, put it on and wear it all day, because the more awareness we have about this, the more we will get to where we need to be, which is the garden of white flowers, meaning that we have survivors. This, again, you cannot do anything but feel wonderful for being a part of this. It is an exciting day. It always is. I'm going to miss the fact that we're not actually out there with one another, but I will be there, and I will be there virtually, and I look forward to seeing each and every one of you, and we're going to raise a lot of money and make a lot of progress toward ending Alzheimer's.
Well, Mayor Johnson and Gino, I want to thank you both for your time today. Of course, talking about the virtual Walk to End Alzheimer's, Saturday, October the 3rd. Again, we got all the great information. We'll have that information back up on the screen again to show you how you can take part if you haven't already registered and be part of that very special day. Again, as everyone's walking to find that cure for Alzheimer's and working toward raising funding to do so. So again, thank you both for your time today.
Thank you, Tim.
That will do it for this edition of On the Scene. I'm your host, Tim Kelly. We'll see you next time.